Good morning. Am I ready? Okay. Good morning. I'm Dr. Jessica Sapoff. You're listening to Dental MD. And today I'm going to talk about the kind of just defining what holistic dentistry is, why it might be difficult to find a holistic dentist. What does the word mean, and why do some dentists use different words to differentiate themselves from the mainstream? So we're also going to define mainstream because that is the majority. But science is not done by majority rule. And there are people who say really nothing should be, but that's a whole separate conversation. So science isn't done by consensus. A thing is not considered good science if a lot of scientists agree with it. That's just not how it's defined. There can be very good science and nobody agree with it because it's so different from what everybody thinks is true that it gets criticized. And we all know what the stories are like that. Flat Earth, all that kind of thing. And many other examples. So, all right. So, mainstream happens to be the way that the majority practice. They believe that the way that they practice is based on science. The mainstream conventional dentists practice according to the principles of Western medicine, which believes that its principles are based on scientific foundations, scientific research. And then there's an entire other group who also believes that their views and their way of practicing and their philosophy is based on science. But everybody's got a different pile of research papers to point to. And it isn't necessarily true that the people with the tallest pile of research papers wins. What's true is if the research is done in a way that accounts for confounding factors, research is not as cut and dried as we might like. So it's, that's an interesting topic in itself, is how do you evaluate research and whose point of view is going to dominate how that research is evaluated. And as we know from the movie All the President's Men, if we follow the money, we will get to the bottom of it. And that still holds true. That piece of advice, follow the money, that really holds true. And that is difficult to do sometimes. Sometimes it's hard to figure out who stands to profit from a particular idea or a particular finding. So, and sometimes the way that people profit is not direct. Sometimes it has to do with reputation and notoriety and fame, which enables them to make money in other ways by using their name and face to promote other things. So what may seem selfless because a profit isn't being made in the immediate moment of, a research paper being exclaimed to be true findings, that person promoting that may not be making money directly from that paper, but they may stand to profit in the future by becoming famous and being able to use their name and notoriety to make money. So anyway, there's a lot to look at when it comes to research. Whose research are you going to look at? And I'll just give you kind of another more visible example than medicine and dentistry, and that is diet and nutrition. Look at how many people are pointing to research to support their point of view on what you should and shouldn't eat, and there's almost no agreement, except if you listen to some people, they'll list out all the people that agree with them in order to get you to adopt that viewpoint, which they are personally invested in because their reputation hangs on that being true. The the nutrition wars are almost as bad as politics at the family Thanksgiving table. Let's face it. Everybody's got a different idea of, whether turkey should be on the table and whether the gravy should be high fat or low fat and have wheat or not have wheat. I mean, the discussions can become very heated at the family dinner table over nutrition, politics, and the discussion between holistic thinking and natural medicine versus conventional. That can also be a bit sticky. That can really get heated. And the reason is because, if Aunt Sally has this or that ailment or disease, there may be family members that don't want Aunt Sally to get conventional care. They may feel that that's going to send her on a downhill rather than using more natural methods to assist her body in doing a more comprehensive healing from within, et cetera, et cetera. And so there may be, depending on which family member and whether there are family members that are knowledgeable in alternatives, there could be some heated discussions on that as well. So for today's show, I want to talk about the differences of opinion on natural and holistic methods of approaching healing and healthcare versus what I would call conventional or mainstream or Western medicine-based thinking and majority thinking, because obviously whoever's in the majority gets to call themselves mainstream, and they get to sort of ride on that consensus wave as a way of making it seem like that's the more likely to be correct way of thinking. All right, so when it comes to dentistry, I mean, people have heard of naturopaths, people have heard of osteopaths. I may not know what that is, but they know chiropractors aren't regular MDs. They know that they may know that there was a long battle between MDs and chiropractors, very long battle. And eventually, mainstream medicine seems to kind of envelop these other ways of doing things and try to bring them into the fold of mainstream medicine. For instance, by trying to define what standard of care is so that anybody working outside of what the mainstream says is the standard of care for a particular ailment, disease, injury, whatever it is. And then they can, if a chiropractor, for instance, is approaching that problem from a different method or idea, that would by definition be considered not the standard of care and therefore below the standard of care, because the gold standard, as they keep calling it in medicine, is whatever the MDs are doing and say should be done. But why is it that they get to define everything? They're framing everything. They're making the decisions and then pointing to everybody else as being not just not mainstream, but not within the standard of care. And that's a very important legal term for what people do. So the other groups have had to shift how they talk about things and how they do things. And for instance, as a holistic dentist, if I have a different idea about how something could get solved, in order to be in compliance with the what's considered standard of care by the mainstream, which is the majority, which is how everybody gets compared to that, I always let patients know what the mainstream views are, what the usual and customary mainstream way is to deal with certain things, so that people know that they have that as obviously people have a right to know they have that as a choice. And that's a good reason to tell people about it. But the other reason to tell people about it is to make sure that they knew what that other choice was before they chose what we do. But mainstream doesn't have to do that. They don't have to say, well, I'm going to give you this painkiller, but you could use white willow bark. I feel obligated to tell you that you could just go to the, natural food store and buy, this and that herb, and that could also solve the problem for you. I feel I should tell you that. The mainstream doesn't do that. They don't give the same time and respect to alternatives that alternative people have to give to mainstream. And that just has to do with them being in the majority and being the majority point of view. But like I said at the beginning, science is not done by consensus, but a form of bullying is done by consensus in this case. But you do still have choices, and there are choices in every single field. Medicine, you have choices, and dentistry, you have choices. There just are fewer holistic dentists than there are holistic medical practitioners. And I'm going to take a break here just in a minute, but I want to say that in the next segment, I'm going to go a little bit more into why that is, and then I'm going to talk about what some of the other differences are in philosophy between alternatives and mainstream gets to be called that because they're the majority. All right, you're listening to Dental MD. I'm Dr. Jessica Sapoff, and if you want to get an appointment with us, get a second opinion, or make an appointment for a new patient exam, you can reach us by email at appointments@naturaldentist.com. And you can also call 425-427-8899 and make an appointment that way. All right, I'm going to take a break, and I'll be right back.
People say it's hopeless. Money rules the world. It rules with an iron hand, and we're helpless in its hold.
So how long has it been since you've been to the dentist? Yeah, I'm talking to you. I know going to the dentist can be tough, but did you know that healthy teeth lead to a healthy body? I know what you're thinking. All dentists are alike. They lure you in for the free exam or, complimentary cleaning. And before you know it, wham! Huge dental bill. And did you even need all that work? Well, why not try a different approach? Natural Dental Health Associates in Issaquah specializes in taking care of you. Their easy, no gimmick, honest approach to dentistry will have you forgetting you're actually in a dentist's office. And the best thing is, they're all natural. Yep, no mercury, nickel, or other harmful chemicals are used. Click on your media player now and get started on the road to better dental health today. Or call 425-427-8899. Natural Dental Health Associates is a proud sponsor of the Dental MD radio show, Wednesdays at 9 a.m. on Alternative Talk, 1150 a.m.
It took me a long time to be able to say Chandler has cancer, because that is such a scary word. St. Jude takes care of absolutely everything. And knowing that we don't have to pay for all of the medical expenses, that's huge.
St. Jude allowed me to focus on being a mom to Bryce. And sometimes I'm just in awe of the impact St. Jude has, not only on this community, but the world.
St. Jude is uniquely positioned to advance the cures of pediatric cancer, I think better than any other institution in the world. The contributions make a big difference.
Donors are important to us because you get the feeling that you have a team behind you. We have the resources and we have the focus. And so if St. Jude doesn't do it, who will?
St. Jude Children's Research Hospital. Finding cures, saving children. Learn more at stjude.org.
Make us part of your daily routine. Alternative Talk 1150.
You're crazy. You can't break that wall. It's too old, too big, too strong. Never gonna fall. I say.
Welcome back. You're listening to Dental MD. I'm Dr. Jessica Sapoff. And today I'm talking about the differences between different philosophies in medicine and therefore dentistry. Dentistry is kind of a branch of medicine. It really, started out as, at one point it was kind of thought of as part of medicine, and then it branched off and independent dental schools were formed. And this was all after the dentist-barber routine, because the barbers had chairs that were adjustable, and so they were the ones that could tilt their chair and take out teeth. Anyway, that was the original reason why barbers were doing dentistry. So, yes. So
I
I was
honestly think I didn't know that. So while you're in there getting kind of a
shave,
and a haircut, or oh hey, by the way,
it's true. I used to make jokes about it because I would cut my kids' hair, and I'd be like, the dentist barber. Yeah.
Just yank one of those.
Yeah.
Clean them up.
Yeah, right. So anyway, in dentistry, I was going to talk about why there are so few holistic dentists. And one of the reasons for that is that there are no holistic or natural dental schools. The only dentists who have become holistic either kind of left the mainstream because of their own health journey sometimes, and other times it's just, they hear about it and then they learn more about it, and then it becomes part of the way they do things, because when they start to look into it, some dentists come to the conclusion that the science on the side of natural and holistic approaches, that there's some good science. There's a lot of very good science, actually. And if you never look at that and you only listen to the mainstream training, you would think that, that the only good, that if it was really good science, the mainstream would have already told you about it. That's really the one of the attitudes that mainstream conventional practitioners have, is that, well, if that research was actually any good on, take your pick, fluoride, mercury, root canals, if that research was any good, we would have already heard about it. The American Dental Association would have told us about it in our journals. So it must not have passed the test of being good enough research, and that's why we haven't been, it hasn't been written about in our journals. But that's, I'm going to say it's a little bit naive, but it is the prevailing attitude. If it were true, I would have heard about it already. And this is a block in a lot of fields, not just medicine and dentistry. You could bring a new idea about an invention to an engineer, and they'll say the same thing. They'll say, well, if that worked, I would have already heard about it. It would have been in our journals, and it would have been taught in the schools, and especially if it's an old idea from 100 years ago, then they're even more likely to say that. So I recommend that as a layperson, that you not criticize or discount a professional's view that if they had heard, if it were true, they would have heard about it already, because that is a natural outgrowth of how we are trained. People really can't help having that response to research, especially if it's older research or if it's new research that they haven't heard about. And it's just the way professionals are trained. There are, I heard a funny term for it in a show on Gaia.com, where they referred to, instead of saying academics, they called them quackademics. And that was, not very nice, but kind of funny. So the thing is with dentists is that there are no natural schools. There's the only place a dentist could go to get training in holistic concepts, and the other words for it are biological, integrative, complementary. There are a lot of terms for alternative practice, and alternative means that there's some other way other than the majority way, and the only way that a dentist could get this kind of training is after they've been through a mainstream school where they're much more likely to reject anything that isn't similar to what they've already heard. But there are some organizations that provide professional continuing education to dentists and cover all the areas of holistic thinking and natural medicine as part of that additional training. Now, how do dentists find these things and find out about it? There are 6,000 dentists in Washington State, and I would say maybe 15 or 20 or 25 have been to any kind of holistic or alternative continuing education for professionals in dentistry. It could be more than that, but I think that's about all it is. And many of those people are kind of just picking and choosing. They're keeping some conventional concepts, but like maybe they think mercury is a bad idea, but they still want to put fluoride in everybody's mouth, every kid, every adult. Or maybe they don't think fluoride's a good idea, but they're still placing amalgams, mercury fillings. So I would say that from what I can tell, there are maybe between 10 and 15 dentists that embrace holistic concepts on the majority of dental procedures and overall philosophy. And that's not very many. There are 6,000 dentists in Washington State, and I'm saying maybe 10 or 15 of them are really comprehensively embracing holistic thinking in their practice. Many of these dentists still have latex products in their offices, and many of these dentists, I would say all of them, are general dentists. I don't know if there are any specialists that have become holistic practitioners. If there are, I would like to know, but I haven't come across any. And so the general dentists that are practicing according to holistic and natural medical concepts, many of them, like most general dentists, don't treat children. So there are some significantly underserved populations that even have trouble finding a holistic dentist that can meet their needs. This is a very, important topic because we really need to get the word out to not just the public, because the public puts some pressure by leaving dentists that don't do things the way they want, but it doesn't really bring more dentists into the fold of practicing according to the principles of natural medicine. Now, how do we get more dentists to become aware and practice this way? That's a whole nother thing, and that's the next part of my career is probably going to be spent trying to, and I have up till now done a number of lectures for mainstream dentists to help them understand why patients choose to go to a holistic practitioner, and some things about the concepts and a little bit about the science that there is behind holistic and natural medical theory and practice. And the audiences for that are very, very small, but I have done a number of lectures in the past for mainstream dentists, and I will continue to do that. And I will also continue to promote these ideas and choices to the public, because it is important for you as the public to become aware of ways of doing things that suit you better, and become aware that there are dentists that practice differently. I still get patients that come in and say, I I just did this search, and I was just looking, to see if anybody anywhere knew about this thing I heard about and read about or heard from my naturopath, and was looking for a dentist that kind of knew this. And I had no idea that there were natural dentists, that there were holistic dentists. I didn't even know there were any. I was just hoping to find a dentist that knew about this one thing. And that is, it's sad. It's sad that the word really hasn't gotten out in any kind of big way to the public. That's one of the reasons I do this radio show, and I've been doing it for almost 7 years now. Almost 7 years, weekly on Wednesdays. So I'm going to be taking a break here in a moment, but I want to just let you know how you can reach us, and I also want to invite you to let people know about this radio show and to let people know that there are holistic dentists and holistic dental organizations where dentists can go to learn some of these concepts and techniques and hear about some of the science they did not get to hear about from mainstream sources. All right, if you want to call us to get an appointment or ask questions, you can reach us by email, appointments@naturaldentist.com. Also, you can give us a call, 425-427-8899. I'll be right back.
No wall too tall to fall. No wall too tall.
I'm Dr. Anthony Lazowitz, and this is Climate Connections. Tropical Storm Irene devastated homes in a low-lying neighborhood of West Haven, Connecticut. A year later, Superstorm Sandy did the same. Residents knew it was only a matter of time before they got flooded again.
You have people they're just stuck in a terrible situation, and the condition was getting worse.
Mark Payne with West Haven's Department of Public Works says continuing to rebuild in that area no longer made financial sense. So the city turned to a federal floodplain easement program.
The federal government was offering to take a look at these high-risk properties and allow the homeowners to be bought out at the value of their property the day before the storm rather than the day after.
The houses are removed, and the property gets put into an easement so it can never be developed. Then the city and federal partners restore the land to marshland habitat, which can absorb floodwater. It's a hard decision to leave a home behind, but for the few dozen homeowners who have opted in, the program offers an affordable way to move to higher ground, and the land they leave behind will help strengthen the city to withstand future storms. Climate Connections is produced by the Yale Center for Environmental Communication. Learn more at yaleclimateconnections.org.
Alternative Talk 1150. We're on your radio at 1150 a.m. We're on your HD radio at 98.9 Channel 3.
So many ways to listen.
We're on the web at 1150kknw.com, streaming live audio and video as well as MP3 archives of many of our shows.
So many ways to listen.
And now, we're on your smartphone or tablet. Download our free app in the Apple App Store or Google Play and take Alternative Talk 1150 anywhere you go.
So many ways to listen. Want to hear something different from talk radio? Keep your dial on Alternative Talk 1150.
Money vendors crowd the temple. Survival crowds the heart.
All right, you're listening to Dental MD. I'm Dr. Jessica Sapoff. Welcome back. Today I'm talking about the differences between holistic and natural versus mainstream and conventional. And it's very difficult for practitioners to actually learn about. It's hard for them to find out about it, but it's hard for them to get that there could be research that's good research that they haven't heard about. Please be kind and gentle to your professionals, not only the ones you go to, but the ones in your family who are resistant and consider themselves to be skeptics. There are two different kinds of skeptic. One is actually open and willing to look at new ideas. And the other skeptic is mostly going to be just skeptical about the things that they have not heard about yet or that they've been told aren't true. And so they're going to be, they call it skeptical when they are kind of rejecting a new idea. But, you know, this is kind of an ironic thing that the mainstream considers people who are looking at alternatives to be gullible. But in actual fact, one of the reasons that I looked at alternatives is because I am skeptical about the things I'm told. I don't just take what I'm told, even if it's from mainstream. That does not give it a golden hue of truthfulness in my book. I look at everything the same way. I don't accept things from the mainstream but be skeptical about things that are alternative, or vice versa. There are also people who, if it's alternative, then it's probably true, and if it's mainstream, it's probably not true, or, you know, or if it's mainstream, then it's definitely, you know, based on somebody's trying to make money. Or these attitudes are not true skepticism. A true skeptic looks at everything with the same demand for good evidence before being accepted. The skeptic that is blindly accepting of mainstream but only skeptical when it comes to alternatives, that's not a true skeptic. And the same is true for people who accept something if it's alternative and are negative toward anything that happens to fall under what the majority see as true in medicine and dentistry. So, but it is important to really be kind to people who are not true skeptics and who maybe are cherry picking what they're going to be skeptical about. So I consider myself to be a good skeptic because I'm similarly skeptical about any new information that comes to me, including mainstream. And that actually is what enabled me to, because I look at everything with the same kind of scrutiny, I actually came to the conclusion that some of the research on about mainstream things that are not concluding the same thing the mainstream concludes, so they would be considered alternative conclusions, alternative interpretations of the same science, I came to the conclusion that some of the natural and holistic concepts made more sense. So, you know, those of us in the holistic and natural community, even though the mainstream may view us as gullible, we're actually not necessarily gullible because we did not swallow hook, line, and sinker mainstream views that were just handed to us from authorities such as the AMA and the ADA. I did not take that hook, line, and sinker. I demanded to know what the original research was, who profited from that research, and what the conclusions were. And I don't just read the abstracts and the conclusions. It turns out that in the body of the research paper, they actually have interpretations of the data that don't sometimes have interpretations of the data that do not match the conclusions that are drawn. The conclusions that are drawn for the benefit of the people who stand to benefit from those conclusions, like sell a product or an idea or a procedure to be considered mainstream, whatever it is. You know, it's a lot of work to read whole articles. You have to do research. Sometimes you have to pay for the articles. It is much easier to let our illustrious organizations sift through that stuff, draw conclusions, and then train the rest of us in the conclusions that we ought to have and ideas that we should have and opinions we should have to form the basis of our treatments. That is understandable because the amount of research there is out there is astronomical. You could never look at all of it. You have to rely on people to read different parts of the puzzle, and you read in the journal what the conclusions were. But if you have any doubt about anything, you do have to go back and read the original articles yourself. And that's a lot of work, and it can be expensive, and it can be a full-time job doing that. So you do have to rely on professional journals. That's understandable. But unfortunately, those professions have now, they've shown themselves to be somewhat less than completely honest with us about what the real data and real conclusions would be from that data. It's unfortunate, but just like with government and other authority organizations, many people have lost faith in these groups. And everybody now, you've got to be your own advocate. If you go in and see a doctor or, any other health practitioner, and when I say doctor, I'm talking about physicians and dentists and chiropractors and anybody with a doctorate, including nurse practitioners who have PhDs. They are also doctors in their field. If you go to somebody with a problem and they tell you what they think it is, what they think you should do based on their background and training, and you have to be your own advocate. You have to have your own mind and say, okay, I hear what you're telling me. I'm going to go look up a couple things, and I'm going to talk to some other practitioners that have other conclusions and other ways of doing things, and then I'm going to come to a decision about what I'm going to do about my problem and who I'm going to go to and which therapies I'm going to engage in to try to get healing. That's all fine if things aren't urgent, of course. I always throw that in. If it's an urgent problem, you really don't have the time and luxury to go doing your own research. Sometimes you just have to swallow a pill, so to speak, and get your body at least to the point where it can take over the healing. And when you're not in a crisis, then you have the luxury to start investigating other options, other ideas, other points of view and ways of doing things. But you have a right to do that. It's exhausting, and these days we have to do that on practically everything that we have to do in life. You have to be your own advocate, or the advocate for your children, or sometimes for your spouse. And that's just the way it is these days. But there are a lot of good books that have been put out for lay people who haven't been through the education that the doctor has been through. And there are shows like this radio show. Now, you can go back and look at archives of this show. I've got lots of different topics. I don't always talk about philosophy the entire show like I did today. But you can listen to different topics like root canals, third molar extractions, orthodontics. No matter what the topic is, there are multiple point of views about it, different research on different sides, different ways to approach it, a different age to start doing it. And I contrast in those shows what natural and holistic dentists usually do and why, and what mainstream and conventional dentists do and why. And that is, if you have a particular issue, you can go back and listen to a show on that particular issue. But a show like today's show, where I'm talking about the philosophy and concepts and why we have these problems and why there aren't more natural and holistic practitioners, that's important to understand. And it actually ties in with a lot of other issues in our society, including politics and capitalism, and just every aspect of our society seems to have been a contributing factor in why medicine and dentistry, why we have the problems that we have and the discussions and arguments and disagreements that we have. So I think it's worthwhile to look into that to some degree and see how it reflects on our society as a whole. And not surprisingly, I'm pretty well versed in what has happened and is happening politically and otherwise. Because to me, those are, and I also look at our civilization. I don't just look at current events and current problems. I look at everything going back, 1,000, 2,000, 12,000 years, what has happened in our history that has led us. And it's amazing. There are actually things that happened that long ago that have an impact on our civilization today and why we are the way we are toward the earth and on our planet. And part of being holistic and natural for me is not just our bodies and how we interact with each other, but how we treat our planet, how we treat the earth. So I'm going to talk a little bit more about those issues in the next segment. If you would like to make an appointment to have a dental appointment at a natural office, Natural Dental Health Associates in Issaquah, give us a call, 425-427-8899, and you can also reach us by email, appointments@naturaldentist.com. And I'll be right back after this break.
In our world, I say no wall too tall. No wall too tall.
And now, a message from the American Migraine Foundation.
It's an absolute nightmare. I was terrified. It was like your head's gonna explode.
Migraine is a disabling disease.
Just all of a sudden couldn't see. Migraine has ruined my life. Absolutely terrifying.
There's pain that does not stop.
It's a throbbing, pulsing, banging, hammering feeling in your head.
36 million Americans suffer.
I started getting migraines around 5 years old.
Just takes over everything.
I feel trapped by migraine.
It hurts like my head's gonna fall off.
And the whole world around you stops.
My world has gotten small.
You feel like the world's closing in on you. There's nothing you can do.
I had spent a year housebound.
It's like you're trapped in your head. There's no escaping it. You can't leave your body.
Don't suffer alone. Make your move against migraine. Visit AmericanMigraineFoundation.org to find help, learn more, and get connected.
So how long has it been since you've been to the dentist? Yeah, I'm talking to you. I know going to the dentist can be tough, but did you know that healthy teeth lead to a healthy body? I know what you're thinking. All dentists are alike. They lure you in for the free exam or, complimentary cleaning. And before you know it, wham! Huge dental bill. And did you even need all that work? Well, why not try a different approach? Natural Dental Health Associates in Issaquah specializes in taking care of you. Their easy, no gimmick, honest approach to dentistry will have you forgetting you're actually in a dentist's office. And the best thing is, they're all natural. Yep, no mercury, nickel, or other harmful chemicals are used. Click on your media player now and get started on the road to better dental health today. Or call 425-427-8899. Natural Dental Health Associates is a proud sponsor of the Dental MD radio show, Wednesdays at 9 a.m. on Alternative Talk, 1150 a.m.
Easy on the ears, good for the soul. Alternative Talk, 1150.
Wall too tall to fall. No wall too tall.
Welcome back. You're listening to Dental MD. I'm Dr. Jessica Sapoff. And I want to talk some more about why holistic dentistry is, for me, it involves much more than just the procedures, why we do a certain procedure, how we do the procedure. In the way that I do things is, according to natural medicine, which is the least toxic and least invasive possible way to do everything. And sometimes that takes longer and sometimes it's shorter. It's not always, it just depends on the procedure. So I was talking about the earth in the last segment, and I want to say something about the environment, because we have three environments. We've got our body. The inside of our body is an environment of our body. We've got the indoor air, the indoor pollution that we are exposed to in indoor spaces. And we've got the outdoor environment, which is the planet and the pollution of our planet and our air, water, and earth. And all three of those environments are critical for our health. You can't just focus on your body, and you can't just ignore the body but worry about, formaldehyde off-gassing from the, whatever carpeting, whatever it is, or fragrances that people wear that are not natural fragrances, that are synthetic chemicals that they wear that are in the air that we all have to be exposed to. So the outdoor environment is, of course, we all battle to try to have decent water to drink, and that sometimes involves elaborate processing of our water. Once it comes from the municipality, it's got some things in it we don't want, and it's lacking some things we do want, and then we've got to do home water treatment in order to try to get water that we think is going to be healthy for us to drink and hydrating and not harmful. So when I do dentistry, I'm thinking about all of those environments. I don't want to create any pollution for you in your body. I don't want to pollute the indoor office air that we all walk around in all day. I don't want to breathe polluted air. I don't want mercury vapor in my air in the office or any other kind of dust or particulate or off-gassing or anything else, because I spend a lot of hours in there. And I don't want anything we do to pollute the planet. And so we also try to minimize how much just trash and garbage. I will use things that have to be sterilized instead of buying disposables. And disposables became, a big fad in dentistry. Everything was, throw it away and get a fresh one for the next patient. Well, why not be a little old-fashioned with that in particular and just buy the things that can be run through a sterilizer? Reuse things. Sterilized, of course. Anyway, there are lots and lots of little details about what I do, how I do it, and why I do it that way. And there's also, if I do things a particular way to minimize stress for you, stress is a type of stress is a type of body pollution. When you're stressed over things, your body responds to that with a lot of hormones, adrenaline. Your digestion doesn't proceed if you're under stress. It's hard to digest things. You can get stress and like tension in certain muscles that can result in referred pain patterns that then become another thing to try to treat that's confusing, and everybody's got a different opinion. Like, what if the referral pattern from a tight muscle is into, let's say, your jaw joint, for instance? Everybody's going to try to treat your TMJ, and maybe it's not even TMJ. Maybe you just have a neck muscle that's spasming, and it's referring pain into your neck. This would be like people who are having a heart attack and feel pain in their left arm if everybody focused on fixing their arm. Like, we know better when it comes to that. Oh, left arm pain, we better check your heart. Okay, so, but in dentistry and head and neck issues, referred pain patterns are not something well known in the mainstream and conventional practice. And even among holistic practitioners, it is not always understood well. I would venture to guess that most of them at least have heard of it and know about it, how it affects diagnosis of head and neck problems and oral health problems. So that is, it's, where was I going with that? Anyway, for holistic practitioners, for me, I try to do everything in ways that are the least invasive, including emotionally, because that creates a lot of havoc for us, for our lives, and also for our health. So the low trauma way to do things, the low emotional trauma, sometimes that's faster and sometimes it's slower. Sometimes it's multiple appointments. Now, in holistic practice, a lot of the patients do not want to be drugged for their treatment. And I'm not talking about anesthetics. I'm talking about sedation. They don't want their children sedated. They don't want to be sedated. They want to be alert, awake, and at choice throughout their treatment. Sometimes that means we do only a little bit at a time, like with kids or adults as well. We might spread out the treatment, or we might do something simpler and then plan for something more complex later. We might do a simple fix now just to halt the progress of something or prevent further damage to something, and then work on what the definitive solution is going to be over time. If that's how somebody needs it done in order not to feel upset, or in order not to feel stressed, or in order to have it go at a pace that they feel comfortable with for whatever reason, then that's the way I'm going to do it. Now, in the most dental offices, both holistic and mainstream, the best way to do things is the most efficient way, because that is the most profitable way. And so what's efficient is to get you in the chair and do as much as possible, do everything if possible on that one appointment. And if you're fearful or that upsets you in any way, or you feel like you're not going to be able to handle that long of an appointment, well, we've got sedation. And that, unfortunately, has become like a way to get a lot done, definitive treatment done in a short period of time. It's very efficient for the office, very high profit, and that's one of the reasons that it's talked about so much. And so many dentists have learned to do this. And I understand it. I got all the training so that I could do that for people who choose it, not so that I can talk people into it so that I can do more dentistry in each appointment and make more money. That's a whole different approach. I learned it because there are a few people who really have a significant post-traumatic stress and need some kind of help with a medicine like that, even if it's a small dose and a very mild, to help them get through the visit, even when we're doing something simple and short, without having the stress inside their body be so just unmanageable and uncomfortable for them. And that's when I think it's appropriate, when the patient chooses it in under conditions like that, where it's really, helpful. But unfortunately, like a lot of things, it's been taken way out of proportion and used as a way to improve profits in dental offices, which is understandable. You have to make ends meet after all. But I think it's been taken too far by a lot of people. So anyway, the way I practice dentistry is always by first listening to what you have going on and what you want and what your preferences are. And then I'll tailor everything that we do, including how long it takes to do it, to what your needs and preferences are. And that goes for your children as well and your family. All right. Well, you have been listening to another episode of Dental MD. I want to remind everybody that you can go and listen to the archives on KKNW1150kknw.com under Dental MD. And there are lots of different topics. I've been doing this for a long time. You can go back into the older shows, or I've covered all the topics multiple times, multiple ways, from multiple points of view. And so you will find a show that speaks about the topic you're interested in a way that helps you understand it. And then if you have questions about anything that you're hearing or hear in those archived shows, please give us a call. Ask us your questions. Make an appointment if you wish. You can reach us by email, appointments@naturaldentist.com, or by phone, 425-427-8899. I am Dr. Jessica Sapoff, and the name of the office is Natural Dental Health Associates in Issaquah. Thank you very much for listening, and I'll be back next week. This is Dental MD.